Well, it was just 5 years ago today that French President Emmanuel Macron announced France's first lockdown due to the COVID-19 pandemic. A lockdown that lasted for nearly 2 months, followed by a let-up and then more tightening of restrictions over a period of nearly 2 years. Well, that pandemic, of course, profoundly affected health and well-being around the world, leading to widespread social isolation, reduced physical activity, and prompting significant lifestyle changes that posed many risks to people's mental and emotional health as well. Studies in the years after COVID-19 have shown the pandemic was particularly hard on young people. And we're going to talk about the mental health effects now with psychiatrist and university professor Vivian Kovess-Masfety, who joins me now on the set. Vivian, thank you so much for coming in to talk to us. First of all, why was COVID so particularly hard on younger people?
The mental health of young people has never been so good. I mean, it is an age when a lot of things are happening, and there is a focus of young health, but in fact, they never be so good. So it's very hard. I mean, it's when we are talking about the COVID, it depends very much on situations. I mean, first of all, even between European countries, there were a lot of difference between Denmark, Norway, France, as you know. So the consequence could have been different. Then we do not have such good studies, you know, with data before and afterwards. So I try before coming to make a sort of revision of all what that has been published. And the main question is, what's the situation today?
Well, so, what is the answer to, I mean, what kind of long-term effects now are we seeing linked to the pandemic and the lockdown?
I mean, if 5 years appear long-term, you know, what we can see is that at least in France, the situation is going better for young people, and in other countries as well. So the data today, in fact, are very reassuring. I mean, for example, I have a paper which is refuting the myths of its tsunami of mental ill health in the population affected by COVID. So, you know, people were expecting something very hard on mental health, and in fact, it doesn't happen. So in terms of suicidal rates, suicidal attempt, and so on, you know, most of the population was stable, in fact. And a lot of them were recovering. And what is clear is that the more fragile, in fact, were very much affected.
Indeed.
Yeah.
So people who are already, perhaps what we can say is that the pandemic exacerbated pre-existing conditions for
That's
people.
very true. That's very true. And some of them are going better, some of them not. But, you know, basically, the more fragile were the more affected.
What are the signs of depression that young people or parents of young people or loved ones should look out for if we're going to be worried about someone and particularly their state of mind? Is there anything in particular to watch out for?
I mean, that's a real problem because, in fact, a lot of data came from symptoms. That means recent symptom and probably transient symptom. And there was a sort of confusion between transient symptom, what happened very often in young people who have up and down, as you may know, and a real true depressive disorder which need medical attention and so on and so forth. So, you know, we have to find a balance between, of course, looking at the children, and the other hand, not spend our time waiting that they maybe have some depressed symptom and start worrying about it, because at the end, it could be self-predictive. That means, you know, you always tell the young, you know, they may be depressed. You tell the parents they may be depressed. So, you know, it's like something that is a bad ambience that, you know, parents and adolescents especially have to trust themselves. And, you know, so this sort of mix between transient symptom reacting to something difficult versus disease is a bit embarrassing.
So in your opinion, this was perhaps self-perpetuating, this idea of more depression coming out of COVID-19 and the pandemic?
Yes and no. I mean, you know, it's very difficult today, 5 years after, to attribute to the COVID any depressive symptom of young people, because a lot of other things happen, as you know. I mean...
Vivian, thank you so much for coming in to speak to us. Vivian Kovess-Masfety, thank you so much, a psychiatrist and university professor. Thank you very much.